It is the scapula of right side. It has costal surface, dorsal surface. Dorsal surface is separated by supraspinatus fascia and infraspinatus fascia by crest of the spine. It has three processes: coracoid process, acromion process, and spinous process. It has glenoid cavity. It has supraglenoid tubercle and infraglenoid tubercle. It has three angles: superior angle, inferior angle, and glenoid angle or lateral angle. Three borders: superior border, medial border, and lateral border. Costal surface presents three longitudinal ridges. Superior angle is covered by trapezius muscle and inferior angle is covered by latissimus dorsi, which helps abducted of the arm. Now, costal surface attachments. From superior angle, first dissection of the serratus anterior is inserted. Medial 2/3, second and third dissertations of the serratus anterior inserted. And from the inferior angle, lower 4 or 5 dissertations of serratus anterior is inserted. This is the suprascapular fascia. This is the subscapularis fascia. This is suprascapular fascia and this is infrascapular fascia. Medial 2/3 of subscapular fascia gives origin to the subscapularis muscle. Medial 2/3 of supraspinatus fascia and upper surface of spinous process gives origin to the supraspinatus muscle. Medial 2/3 of infraspinous fascia and lower surface of the spinous process gives origin to the infraspinatus muscle. Deltoid muscle gives origin to the lower border of spinous process and lateral border of the acromion process. Trapezius muscle is inserted from the upper border of the crest of the spine and medial border of the acromion process. Levator scapulae is inserted from the superior angle to the root of the spine. Opposite the root of the spine, rhomboid minor is inserted, and from the root of the spine to the inferior angle, rhomboid major is inserted. This is the apex or root of the spine. Spinous process have three border and two surface: upper border, lower border, and posterior border. Posterior border is known as crest of the spine, and two surface: superior surface and inferior surface. Lateral border. Upper 2/3 of lateral border gives origin of the teres minor, and lower 1/3 of lateral border gives origin to the teres major. From the supraglenoid tubercle, long head of biceps brachii arises, and from the infraglenoid tubercle, long head of triceps brachii arises. From the medial side of the tip of coracoid process, short head of biceps brachii arises, and lateral tip of the coracoid process, medial tip of the coracoid process, coracobrachialis arises, and lateral tip of the coracoid process, short head of biceps brachii arises. Pectoralis minor. Medial border and upper surface, pectoralis minor is inserted. Now, ligaments. Coracoacromial ligament. Lateral border of the coracoid process and medial side of the tip of acromion process Coracoacromial ligament gives attachment. Trapezoid and conoid parts of coracoclavicular ligament. Trapezoid part gives attachment superior aspect of the coracoid process, and conoid part gives attachment near the root of the coracoid process. Coracohumeral ligament gives attachment to the near the root of the coracoid process. Suprascapular notch, and this is spinoglenoid notch. Near the suprascapular notch, upper border forms inferior belly of omohyoid muscle. Into the suprascapular notch, transverse ligament bridges and it is converted into a foramen. And suprascapular vessels and nerves deep to it. Spinoglenoid notch forms a spinoglenoid ligament. Spinoglenoid ligament bridges into it, and spinoglenoid vessels or nerves deep to it. Now, its movement: elevation, depression, forward rotation. Forward rotation or medial rotation, inferior angle will occurs or lies into the medially, and lateral rotation or backward rotation, inferior angle lies laterally.